Hi, my name is Lindsay Tullis, and I am a Auburn nurse practitioner student. I am also going to be doing a head-to-toe assessment on my patient today. So first, before we came in, we took all the vitals. We took our heart rate, blood pressure, respirations. We took her BMI. Everything was in normal range. Her BMI showed that she was in normal weight for her age, which is a good finding. So now I'm going to start my assessment. So first I'm going to assess the skin. The skin is dry and warm, so not cool and clammy. It looks like it's fairly distributed throughout her entire body. There's no swelling or edema that I feel, no clubbing of the fingertips, no swelling of the hands. She has good warmth all throughout. So I'm going to start off with your head. I'm going to palpate it. What I'm looking for is any kind of lesions or abscesses. I don't see any infestations. Her hair is clean, dry. I don't see any kind of like split ends or anything. So, and it looks symmetrical with her face. So then I'm going to move into your eyes. So I'm going to look at your eyes. Your eyes are symmetrical. The eyebrows, the eyelashes are all symmetrical. They're both round. The conjunctiva is pink and moist. Her sclera is white. The pupils and her iris, everything is intact as should be. So I'm going to do a actual visual exam on your eye today. So first I'm just going to get you to look forward for me, and I'm going to come in on this side. Alright, and what I'm visualizing, so first I noticed the red reflex was present, and I saw some vessels. There were no narrowing of the vessels. The optic disc was present, and she had good vasculature. I would do this bilaterally. For time's sake today, I'm just going to do one side. So then I'm going to move here, and I'm going to look into your nares. I'm going to get you to lift your head up for me. The septum is midline. There's no deviations. She has a good clear nose, no drainage present. I'm going to get you to hold one nostril and sniff in for me. All right, and do it on the other side. All right, nares seem to be patent. I'm going to get you to open your mouth for me and say ah. The uvula rises on midline. Mucosa is very pink and moist. The soft and hard palate is present. I'm going to get you to smile. Teeth are straight. Open it back up for me. There are no cavities present. There's a few fillings. Lift up your tongue. All right, and everything looks great for the mouth. So now I'm going to move on to her ears. So I'm going to massage the ears on the, pull up the pinna. Is any tenderness or hurting here? There has some piercings present. So now I'm going to look in one ear. I get you to turn this way. Alright, the ear canal was very clear. I didn't see any presence of earwax, and I did see the tympanic membrane. It was a pearly gray color, and the conal light was present. For this, I would do both ears, but for the sake of time, I'm only going to do it, so you would do this bilaterally. So now I'm going to move on to the neck. I'm going to get you to tilt your neck back. I'm going to palpate. Is any of that tender? All right. There's no lint masses, no goiter present. The esophagus seems to be in midline. I'm going to come around and I'm going to do a thyroid check. So I'm going to get you to swallow. All right. Could not palpate the thyroid, so that is a normal finding. Now I'm going to check the carotids. Alright, and while I'm here, I'm going to go ahead and listen to the carotids with my diaphragm and the bell. I'm going to be listening for any kind of breweries noted. sounds great. So now I'm going to also check the maxillary and the frontal sinuses. Is there any tenderness there?
Nope.
No? Okay. So then I'm going to move on to the cranial nerves. So first I'm going to do the cranial nerve number 1. I'm going to get you to close your eyes. And I'm going to get you to smell this for me. Can you tell me what that is?
Alcohol.
Yes. All right, so cranial nerve number 1 is intact. Now I'm going to do the cranial nerve number 2, the optic nerve. So I'm going to get you to cover one eye and try to read the lowest line possible.
AFD 2B7.
All right, I'm going to get you to close the other eye and read the lowest line possible.
AFD 2B7.
All right, so your vision turns out that would be 20/20 vision in both eyes. And I would hold that approximately 14 inches in front of their face so that you can get an accurate test. So now I'm going to move on to do the cranial nerve 3, 4, and 6. So I'm going to get you to just stare straight at me, and I'm going to shine this light in your eyes. All right, and the pupils are reactive and symmetrical in size. So then I'm going to get you to look out away from here and follow my pen light to the ear. All right, and that tests for accommodation. So pupils are reactive to light and accommodate appropriately. So then I'm also going to do the 6 gazes. So I'm going to get you to cover one eye. I'm going to cover this eye. And I'm going to tell me when you can see my pen light.
No. No. No.
All right, now do the other side.
No. 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 No.
All right, so that tests for peripheral vision. Now I'm going to get you to stare at my pen light and just follow it with your eyes. All right, now we're going to do this side. All right, so I just saw no nystagmus or ptosis noted, so that was good. So then I'm going to move on to the trigeminal nerve number 5. So I'm going to get you to clench your jaw. All right, there's no painfulness here.
Nope.
So that was the also checking for the TMJ. So I'm going to get you to open your jaw, move it around. All right, so that's good. So I'm going to do a soft touch and a hard touch. So tell me, close your eyes and tell me when you can feel this or what it is, if it's soft or hard.
Soft. Hard. Soft. Hard. Soft.
All right, so cranial nerve 5 is intact. So now I'm going to move to the facial nerve. So I'm going to get you to raise your eyebrows and smile, frown, puff out your cheeks. All right, perfect. So the cranial nerve 5 is intact. I would do a taste test for this, but for time's sake, that would be the sensory portion of cranial nerve number 5. So actually cranial nerve number 7, I apologize. So now I'm going to do cranial nerve number 8, acoustic nerve. So I'm going to get you to cover this ear, and I'm going to repeat, say something.
Doghouse.
Yes. All right, now close this ear.
Butterfly.
All right, so that was testing for hearing. So with that, I'm also going to do a Weber test. So I'm going to strike this, and you tell me if you can hear it bilaterally or feel it bilaterally on both your ears.
Yep.
Okay, so that was testing for lateralization of hearing. So now I'm going to strike it. I'm going to put it behind your ear, and then I'm going to bring it to the air, okay? You tell me when you can't hear it anymore or feel it.
No. No.
Okay, so that was a correct finding. The air conduction is greater than bone conduction when testing the hearing with this. So now I'm going to do the glossopharyngeal and vagus nerve, including, so this would be 9 and 10 and including 12. So I'm going to get you to open your mouth and say ah. The uvula rises at midline. I'm going to get you to push your tongue to each side of your mouth. And so it was putting pressure against that, so that is appropriate finding. Your voice also noted that there's no hoarseness, and it's appropriate. So the those cranial nerves were intact. So the spinal accessory nerve, cranial nerve number 11, I'm going to get you to move your shoulders up and then move them back up, and I'm going to resist me pushing down. All right, move your neck side to side, round and around. All right, that cranial nerve is intact. So now I'm going to move on to the neck. So I'm going to check your lymph nodes. So we're going to check their submandibular, submental, preauricular, postauricular, occipital, and then anterior cervical chain, posterior cervical chain, and supraclavicular. And there are no lymph nodes felt, which is a normal finding. So now I'm going to also do the respiratory portion. So I'm going to inspect the chest. I'm looking for any kind of, I'm also going to be feeling for any kind of thrills, palpitations, any heaves, and I don't feel any. I'm going to start from the back on this. I'm also going to look for any kind of use of accessory muscles, which I see none, and looks like her chest cavity is appropriate for her age. So now I'm going to auscultate these lung fields. Deep breath in and out, in and out, in and out, in. All right, lung sounds are clear. There's no wheezes or crackles. I'm now going to percuss. All right, there was resonance throughout. I did not feel any other hollowness, which would indicate any sort of pneumothorax. So now I'm going to feel back here. And that's going to test for any kind of CVA tenderness. Was that tender at all?
Nope.
Okay. So now I'm going to test for the diaphragmatic excursion. So on one, I'm going to get you to take a deep breath in for me and let it out. All right. So that was normal. So now I'm going to percuss. Wait, take a deep breath in and hold it. All right, you can let go. All right, take a deep breath in, let it out, and then hold it. And you can breathe normal now. So that diaphragmatic excursion is about 4 centimeters, so that's a normal finding. Now I'm going to check for tactile firmness. So I'm going to get you to say 99, 99, 99, 99, 99. All right. That was a normal finding, and I didn't hear or feel any sort of crepitus. So now I'm going to listen to the front. Deep breath in. Deep breath. Good. Now I'm going to get you to say 99, 99, 99, 99, 99, 99. All right, good. So now I'm going to listen to the heart sounds. So we're going to be listening to aortic, pulmonic, Erb's point, tricuspid, mitral valve, and then I'm going to palpate for the apical pulse. I'm going to listen to my diaphragm, and I will do my bell. listen to the apical pulse or feel for it? Sometimes on these smaller patients, it's hard to feel. Okay. So now I'm going to listen to with my bell, and these will be listening for any kind of bruise or throughout the heart sounds. Alright, S1 and S2 was noted, and your heart sounds good. So now I'm going to palpate for the pulses. I'm going to do the radial and brachial. We already did the carotids. I would do femoral, popliteal, dorsalis pedis, and the posterior tibial. And that was plus 3 without. Also noting that if I was going to listen, I should be listening underneath the shirt, but I was going to leave this shirt on today for privacy issues as well, but you would want to listen underneath her shirt. Alright, so now we have concluded the respiratory and the heart. So now we're going to be, I'm going to get you to lay down for me. And I will bring this head up a little bit. Okay, so I'm going to get you to turn that way and look. I'm going to look at her jugular vein. You should see a little pulsation. I'm going to look with my pen line as well. Alright, and it should kind of expand a little bit when the patient lays down. So then I'm going to inspect the stomach. Do you mind if I lift your shirt up? Okay. I'm going to have you pull your pants down just below your belly button. Okay. So first we're going to inspect the umbilicus is midline. There's no scars, no deviations. So now I'm going to listen to all 4 abdominal quadrants. There are present regular bowel sounds, no hyperactive or hypoactive bowel sounds are present. So then I'm going to palpate. Light and deep palpation. You have any tenderness on there?
Nope.
Okay. Deep palpation. You palpate the aorta and any cord hernias. There are none present. So now I'm going to percuss for the liver. Stick this here. Alright, so we have like a 7 centimeters. Usually normal is 6 to 8. So this would be a normal liver size. I'm going to try to palpate it. You shouldn't be able to feel the liver. This would mean that it would be enlarged, and I'm going to palpate for your spleen. Cannot feel that either, so that's a normal finding. So then I'm going to do a reflex on your stomach. You should be able to see your stomach move, and that's good. Alright, so then we have moved on to that. I'm going to get you to sit back up for me. Alright, so I'm going to do a musculoskeletal section. So I'm going to get you to tilt your head, shrug your shoulders, move your arms forward and back behind you, like this. Alright, so now I'm going to get you to put your arms up, resist me pulling. Alright, now I'm going to get you to stand up, move your knees up. Alright, outward, doing some hip flexions. Alright, so then can you pull your arm up? Very flexible. Alright, now sit back down and resist me pulling on you. Alright, so musculoskeletal range of motion is great, and there's no abnormalities found. You can move your wrists and your feet. Yep, that's good. Alright, so now our neuro assessment. So can you tell me where we're at and what year it is?
You're in Mobile and it is 2020.
Okay. And so now I'm going to get you to close your eyes and lift out your hand and tell me what you can, what that is.
Pin.
All right. So that was a good finding. Now I'm going to get you to close your eyes. I'm going to write something in your hand. This will test the graphesthesia. Tell me what letter I wrote.
A.
Perfect. All right. Also, I'm going to ask you a few judgment questions. If you were driving and you saw a red light, red light, what would you do?
Stop.
Perfect. All right. I'm going to ask you to remember these three phrases: red bird, yellow banana, and blue boat. And I'm going to ask you to repeat those at the very end.
Okay.
So now we're going to do the moto part. So I'm going to get you to stand up, and I'm going to get you to do heel toe all the way to the camera. Good. I'm going to get you to come back on your tiptoes. And good. So the moto portion is good. While we're standing up, I'm going to get you to take your arms out. All right. I'm going to get you to close your eyes, put your arms out, stand on one foot. All right. Cerebella, that's good. Cerebella flexion is good. So I'm also going to get you to touch your nose and touch my finger. All right. Now I'm going to do rapid movements. Do this, and then can you do this? Good. All right. And you can sit back down. Now I'm going to do. I did the motor portion. Now we're going to do the reflexes, and also I'm going to do the touch and feel. I guess I have to do something light and sharp. So close your eyes and tell me if it feels like a light touch or a sharp touch.
Light. Sharp. Light. Sharp. Sharp. Sharp.
Okay, good. So our reflexes, so I'm going to get you to put your arm out. All right. That's a radial, brachial. Rest your arm here. All right. That's the bicep. So then we're going to do the patellar. Good. All right. So then I'm going to get you to stand up, and I'm going to get you to rest your leg like you're going to bend it like this. Turn this way. You're going to rest it right here and relax. Relax your foot. Good. All right, now sit back down. And I'm going to check for the Babinski reflex. If her toes would have flared up, that would be a normal finding for an infant, but for adults, it would be a neurological deficit. All these reflexes were +2 and all reacted normally. So I think that would, also I'm going to get you to step up one more time. I'm going to check your spine for scoliosis. Bend over. I don't see any curvature. That's good. And you can sit back up. Now you can bend over, left and right, bend. Perfect. Your spine is great as well. So that would conclude my head to toe assessment. Thank you for watching.